Hi, my name is Carly Hooker. This presentation is all about research on the reproductive system in the human body. The reproductive system is the body system that contains all internal and external sex organs for males and females. I chose to focus on the female reproductive system because that is what I am most familiar with. I also personally suffer from a reproductive disorder called PCOS, and I was curious to learn more about it. I first chose to research PCOS, or polycystic ovarian syndrome. The article I chose was all about PCOS in teenagers. The article discussed the genetic factors of PCOS and how it could possibly be considered an endocrine disorder rather than a reproductive one. The diagnosis of PCOS is actually fairly simple. The diagnosis is mainly made on the basis of clinical presentation in girls presenting with sporadic periods or no periods at all. Clinical diagnosis should be supplemented by the measurements of the follicle-stimulating hormone, the luteinizing hormone, and prolactin and estrogen levels. An interesting fact from the article is that there is a current epidemic of obesity that has very serious implications on the long-term health of women with PCOS. Particularly worrying is the rising tide of childhood obesity that has resulted in an increase in the prevalence and severity of symptoms of PCOS in adolescent girls. I find this interesting because I partially equate my own PCOS now to my health and diet as a child, and I appreciate that there are studies being done to try and change the statistics. The next thing I chose to research was on the BCRA1 and BCRA2 breast cancer genes. The article discussed the prevalence of BCRA1 and BCRA2 genes and how it is rising. In this study, the gene mutation was more common if there was a family history of cancer, and it was even more common for women to have one of the mutations if a maternal female relative had been diagnosed with any type of gynecological cancer. An interesting fact from this article is that BCRA1 is found on chromosome 17 and BCRA2 is found on chromosome 13. I find this very interesting because it points to how advanced medicine has become. We have come so far in the medical field that we know exactly where certain genetic mutations like BCRA1 and 2 are. The third article I chose is on cervical cancer. The article is mostly focused on a study done by the Westminster Hospital in the United Kingdom. 83 women with a mean age of 45 years of age were successfully treated by surgery or radiotherapy for stage 1B cervical cancer and were assessed at a mean of 97 weeks post-treatment. The study focused on the psychological and sexual outcomes after the women received treatment. The women all experienced varied amounts of psychological issues and sexual dysfunctions. Overall, though, the outcome was positive. One interesting fact I found is that almost all patients reported persistent anxiety about recurrence of the disease, and majority were worried about their health generally. I find this interesting because most often people would be inclined to forget such a terrible experience like cancer. But these women were more worried about cancer than anything else. Thank you.